We're going to keep on talking about that, but whatever health system our elected officials settle on in the coming weeks, one idea that should be considered will almost certainly not be on the table, and that is guaranteed insurance for all Americans. Every single one, regardless of income, age. Is it impossible? Well, for fact's sake, the rest of the world doesn't seem to think so.
We need to accept that Obamacare is dead. We need to understand that the reality is that what the choice is between putting in a system that is affordable and accessible or a single-payer, $32 trillion health care plan that the majority of House Democrats support.
When it comes to fixing health care in America, the choices need not be so stark. The single-payer system is only one form of what's known more broadly as universal health coverage. That's a public health system in which every person is guaranteed insurance to pay for medical costs. But that doesn't necessarily mean socialized health care. 58 countries around the globe have universal health care systems, and 34 of 35 developed countries in the world offer some form of universal coverage. All of them except for one. The United States. Here's how universal systems work. There's a mandate that every person must have insurance that covers basic health services. That pools the financial risk of health coverage across the entire population, which brings down costs for all. On average, spending per person on medical care is 60% lower in developed countries with universal systems than it is in the United States. The insurance is paid for through some combination of premiums and taxes. Those payments help subsidize coverage for the people who can't afford it. And that's very different from the current American health system, where thousands of different parties, some private, some public, and some individual, chip in a bit, while millions of people still go without insurance because it's too costly. Calls for a universal system in the United States go back decades, but all attempts so far have failed. Still, new polling by Pew suggests that 60% of Americans think the federal government should be responsible for guaranteeing health care for all. Critics of universal health systems point to higher taxes and longer wait times for doctors because they often prioritize urgent cases. But the U.S. can have long waits, too, more often than not because insurance companies are trying to save money. Meanwhile, health premiums continue to rise. No health system is perfect, but one that gives coverage to all may still have its day.